Namaste. You are watching Dr. KK Med Talks Fridays with Dr. Anita Kant non-stop show 923rd episode. Let's have the headlines of the day. A stressful or traumatic childhood experience, anything from parents divorcing to a sibling's drug problem, may have long-term effects on a woman's sexual health, recent studies have reported. Dr. Reddy's Laboratories Limited has introduced its direct-to-consumer online platform, Celibida Wellness, serving a comprehensive solution for personalized care for individuals with type 2 diabetes and those at risk of developing it. According to a recent study, adults with attention deficit hyperactivity disorder, that is ADHD, are around 3 times more likely to develop dementia than those without the disease. FDA warns about giving prebiotics to preterm babies after infant deaths and other injuries. Abbott launches new vascular imaging platform in India, combining OCT with AI, facilitating physicians a comprehensive view of blood flow and blockages within the coronary arteries. Let's go to the topic of the day. Today, we will be talking about genital care in women, more how to take care of your external genitalia during periods and without periods, especially for women and young girls who are not really aware what all to do, and they are depending on media and causing problems for themselves. And to talk about that, we have a special guest with us today, Dr. M. Balasubramanian. Welcome, sir. Dr. M. Balasubramanian is a distinguished medical professional. He boasts of an illustrious career spanning several decades, having graduated and post-graduated from the esteemed Madras Medical College. Dr. Balasubramanian served as the retired Deputy Director of the Tamil Nadu State AIDS Control Society. With a rich history of involvement in the medical community, he held key positions including State Secretary, President, and National Vice President of the IMA. Furthermore, he has been a pivotal figure in the Tamil Nadu Medical Council, having served as both a member and president. The exceptional journey is marked by accolades such as the prestigious Best Doctor Award from Tamil Nadu Dr. MGR Medical University and a Lifetime Achievement Award from the Times Group. Notably, Dr. Balasubramanian has contributed highly significantly to the field of sexual medicine as the course coordinator for the fellowship certificate program offered by IMA CGP Tamil Nadu. So, sir, it is a real pleasure to have you with us again today. And shall we start?
It's also my pleasure. Right.
Yes.
Thank you for the opportunity also. It's also my pleasure.
Thank you. Thank you so much, sir. So, first of all, I'd like to ask you, what affects the vaginal health of a woman? If you could tell our people listening to us and viewing our program.
Right. Yeah. Before that, I would like to have a small introduction about the human beings. We differ from animals. The animals are four-legged. Even though we have two lower limbs and two upper limbs, our vertebral column is so vertical, and we were able to stand on two legs and carry out most of the things with two hands, and we are able to approximate the thumb with the thing. So we differ from the animals, and also regarding the reproductive cycle, also we little differ from animals. Animals, they do it only for procreation, whereas here, human being, it is from childhood to old age. We do have women, we keep them in high esteem, and we celebrate them, and things are there. See, in medical things, we divide the abdomen into 9 segments. 9 segments we divide. But very often we do not discuss about the 10th segment of the abdomen. That is the place where the reproductive organs are situated. It is like an inverted triangle, facing downwards and frontwards, anteriorly, front as well as lowerwards. So many of the women cannot see their genitalia. Even male, because of if they have high tummy, very big tummy, they cannot see their genitalia also. But women from childhood or things, they cannot see their private parts, especially we even though we say vagina, the entire thing is called vulva or female reproductive organ. And so this carries, see, embryonically, we have analogous for male and female. See, for penis, clitoris is analogous. Whereas vagina, there is no analogous in the male. It is a unique organ thing for the women. It is a birth canal or the tube through which the fetus in the uterus comes out through the vagina to the world and starts crying, and everybody feels happy also. So this birth, it is called a birth canal or thing. And many often we have to blame the media and the advertisement, mainly the advertisements, which misleads the entire population regarding the things. Now it is becoming more open. That is also a danger. But I can share with you a small anecdote where a 5-year girl went to a medical shop and asked for vaginal pad, sanitary pad. Is it for your mother? No. Is it for your sister, elder sister? No. No. My father is taking me to beach tomorrow. If I have this sanitary pad, I can jump, I can run on the beach. See, this is how the media and the so-called advertisement people have done. But now they have come to the other extreme. They show it almost to the how to be used, and other things are there. So it is the duty of the medical professionals not only to cure patients and not only to tell about the preventive aspect. Now our duty is on promotive aspect. The hygiene, hygiene can prevent many of the things. It can prevent illness and also promote wellness. So in that way, care of the vagina is most important, and all women before puberty should be told and explained about the things. So it is most important, I feel.
I
So
agree
vaginal
with
health,
you. Yes. Yes, yes. Please proceed.
yeah. You can please continue.
No, no, you were talking about vaginal health. It's very important. Please continue.
Yeah. See, this vagina is unique in that there is no secretory glands in the vaginal wall. Other mouth, we have secretory gland, parotid and other things. Even skin has got secretory glands. But vagina does not have a secretory gland. But it half a teaspoon of discharge is very, very normal in a woman from menarche to menopause. This one. When does this exudate comes? It is a transidate, not a exudate. That is, from the vaginal walls, it becomes wet, just like our walls become moist during rainy season. And sometimes water also comes inside the thing. It is like that. The vaginal things, this transidate, it comes out. It's about half a teaspoon to 1 teaspoon, 2.5 ml to 5 ml. But the thing is that many people, they mistake this as a disease. It is a normal. It has got the nature has got the self-cleaning mechanism. It is in this transidate is a self-cleaning mechanism of the vagina, which should not be bothered bothered about at all. But when it becomes um, odor, change in color, irritation, itching, like that, if it secretion produces, then we can say the woman has got a vaginal discharge, pathological vaginal discharge. And many times it is due to only three things. Bacterial vaginosis is not a sexually transmitted disease. It can occur in women wearing tight garments, and if they wear swimsuits for a long time and other things, because there is no air circulation. We should wear a garment made of cotton, eh, which is breathable. If they use the synthetic material, these things produces blockage of free circulation, and the organisms uh, from her own body itself produces this bacterial vaginosis. In this regard, I have to share with you the girls right from small age when they defecate, the mother cleans the anus, but when the child grows little and washes the anus after defecation, it should be from front to back.
Yes.
Even the mother,
Yes.
while cleaning itself, she should say from front to back. That is if it is from to and fro or from back to front, the the bacterial flora from the anal canal through anus can be pushed into the vagina and produces this bacterial vaginosis itself. Gardner vaginalis, so many other organisms are there. So it is pushed. Sometimes we see in prepubertal girls having vulvovaginitis, that is severe swelling, irritation, itching due to the thing. This is because the threadworm lays on the anus during night. And because the
Yes.
vagina is very near, this threadworm may move forward into the vulva and produce vulvovaginitis. So genital hygiene should be taught to all girls right from small age to things. So let all the things I think I can answer your questions and cover the subject
Yes.
also.
But you have covered the introduction so well. These things we are facing every day with young women, with older women, the tendency to use the jet to clean the anal opening, and they don't put a hand barring the water from going in front. Recurrent UTIs are also blamed to this. Vaginal
Yeah.
infections are also blamed to this. Urine infection is very common these days. And another thing that I want to talk to you about is that now that we people have started using seats, and they find that tissue paper is lying over there as a roll, so they pick up the tissue paper not only to clean themselves, leaving bits of tissue paper on their genitals. They are also using the tissue paper, which is really not of a very good quality, to clean inside the vagina. So how far you think that should be done, and what problem can it create to?
Yeah. See, regarding the tissue paper, it should be a plain tissue paper. It should not be scented tissue paper. Or sometimes we get uh, inside the package, we can remove one tissue paper, moist, scented tissue paper, and they try to clean the vagina or vulva after urination or anything. It is not at all required. Simple water is sufficient to clean the genitalia. And moreover, nothing should be introduced into the vagina. Only the male part can be introduced, nothing else. Nothing else can be introduced into the female vagina because the pH of the vagina is entirely different from the vulva or the other parts of the body. And when a tissue paper which is used wiped in the vulva, and if it is used into the vagina also, it will carry not only the infection but also inflammation due to difference in the pH also. The Actually, we need not use soap also for cleaning, not only the tissue paper. Ordinary soap, which we use for bathing for the face and entire body, they are alkaline in nature. The pH is 8 to 9 something. Moreover, all of them are scented. And if this bathing soap goes into allowed into the vagina, where the pH is only 3.4 to 4.2, and there will be a disturbance in the pH and normal beneficial bacteria. You should remember, from mouth to anus, we have beneficial bacteria as well as pathological or which produces diseases. Same way, vagina also has got beneficial bacteria. It is called lactobacillus or Dodolin bacilli. These will be killed by this acidic, alkaline soap. So it is not at all advisable even to wash with soap. That is why you will see in some of the advertisement special liquid for vagina, for vaginal wash. It can be used not to penetrate into the vagina. Even some of the women, they use uh, a small nozzle and bulb to enter into the vagina and squeeze so that they clean the interior of the vagina. It is not at all required. I told you it is a self-cleaning mechanism is there. Here, this so-called vaginal wash liquid
Yes.
can be made into leather soap thing, and bulb that the soap for applying the soap, bathing soap in the other parts of the body, so that this body soap will not enter into the vagina. So to prevent that only, we can use this vaginal wash, or so many things are available. So during bathing, after water, just apply it over the genital vulva and the things, then apply soap over the entire body, and finally remember to wash the genital also. You need not pour water into the vagina and to clean and other things. It has got its own mechanism, and every month the God has created 3 days to wash all the things to come out, so that it becomes fresh. It regenerates, become fresh to continue the next cycle. The menstrual cycle it can continue. So no
Very, very well said.
uh, this one tissue paper or bathing soap should to be used.
Right. So this is hair removal a must in that area for women to maintain
Which one?
the hygiene? Hair removal from the vulva.
Ah, see, God has created everything for a purpose. Everything is for a purpose. The pubic hair, which is there, which appears soon after the menarche, if you observe women, they will have a upper limit. It will not go into the abdomen at all. Even if they have a low hip saree, the pubic hair will not be visible. Whereas in in men, it goes up to umbilicus. If they wear underwear or shorts only, go for swimming and other things, you can see the pubic hair into the abdomen. Whereas here, for cosmetic purpose, God or nature has restricted to the upper level. So this hair has got a protective action. It not only prevents the dust, just like uh, hairs on the scalp and other things. Uh, Here, the pubic hair also prevents the dust and other things for that. And so that so no free even during friction, the genitalia is safeguarded by this pad of pubic hair. The pubic pad of fat and pubic hairs are vital. They have got a purpose. But when they try to remove it, if they go to, so they remove it by themselves or by other methods, they are producing raw areas. Multiple raw areas are being created. which will facilitate the pathological organisms like herpes, warts, to enter into the things and produce the diseases. So the entry of the pathological organisms is facilitated by removing the hair, even by shaving or other things. We are producing raw area and sometimes hepatitis B and other infection, even HIV, it can occur. They want entry. These organisms cannot enter through intact skin. Only when there is a abrasion, these organisms enter. So it is always advisable not to remove the hairs. If they want, they can trim it. If necessary, if they feel, they can trim it. It is a fashion for male to have not a clean shaven face. They have trimmed hairs. And that they can have. Women can have trimmed pubic hair. But certainly not removing is not a logical or beneficial.
So, next, can you tell us something about menstrual hygiene? Because that is also an important part.
Sex, Sexual hygiene.
Menstrual hygiene, sir.
Menstrual, sorry.
Yes, sir.
See, I told you, it is a hormone right from brain, the hypothalamus and pituitary send signals to the ovary, and it produces estrogen in the initial cycle and ovulation also, and little progesterone. If the ovum is not fertilized, the progesterone also, the estrogen gets depleted. Progesterone also is not produced that much. So it is a withdrawal bleeding, of the hormones is there. So the if you apart from, see, when we do ovulation study in women wanting for infertility and fertility, we not only do the ovulation, we measure the endometrium, the inner lining of the uterus, how thick it is. So it becomes thicker in the second cycle, that is 15 to 28 days, it becomes thicker. And if the fertilization does not take place, the entire thickened things, endometrium, it gets detached from the uterus and comes out as the bloody discharge from the woman. And it usually is 3 days. 20 cycle is once in 3 days and once in 28 days, and it is mostly painless. If it is painful, if it is more than lasting for more than 3 days, they have to seek the medical gynecologist help to rectify the things. Otherwise, simple, the same hygiene which I had told, simple water is sufficient to clean the genital vulva and other things during menstrual also. And if they use sanitary pads, these sanitary pads should not be kept 24 hours. It has to be changed. Not more than 8 hours. Maybe morning when they go to school or for work, they can wear. As soon as returning, they have to remove that and use a fresh sanitary pad. At least 2 to 3 times it should be changed in a day. And some of the other things are also used, but sanitary pads now it is not that much costly. Even the self-help group women, they are taught to prepare sanitary pads in their village itself and distribute to things. So it has to be used. Only sanitary pads has to be used. In my mother, now she'll be more than now. They were using the used sari and other things during these 3 days, and it was not disposable. They had kept. They will have 3 things each day. They will wear one, wash it, keep it somewhere hidden in the bathroom, and the next cycle they will again use. This is you can get the infection. Most of the infection, maybe anaerobic, even tetanus can occur. That is why we are giving TT to all the women at the age, girls at the age of 12 years, because once they start menstruating and if they use cloth instead of the sanitary pads, they may get tetanus. So that is why we are giving tetanus injections for all teenage girls. So menstrual hygiene is nothing different from routine hygiene. It is almost the same. Only thing is we may have to do in non-menstruating morning during bath they can clean. Here they may have to clean every time when they change the sanitary pads. They have to clean. Simple water is sufficient. Nothing else is required. And douche should not be attempted at all. Douching should not be attempted at all, and it will come out and nothing will happen. So if it is that, then the medical help can be sought, and gynecology will definitely help them and guide them also.
Rightly said. Very rightly said. Nowadays, young girls wear very tight underclothes, and some of them the colored or dyed panties. Can they lead to some allergies and itching?
Yeah. See, because of the leggies or the tight pants and other thing, they not only the underwear, they use synthetic material rather than this one cotton underwear. I told you it has to be breathable. If the oxygen or air if does not enter, we see tinea corporis in college girls wearing leggies and other things, which usually we see tinea corporis, a fungus infection, only in people who do not take bath, who have a lot of sweat and other things. These people are with perfume and other things, but there is no circulation in the thighs and genitals, and they land up with fungal infection. Many times these fungal infections are resistant to routine drugs which we use. It has to be used for a longer time. They have to change then dressing material and other things. Many times they will not be willing to do it also. And the next one is because of this, it can lead to, I told you, bacterial vaginosis.
Yes.
The bacterial infection of the vagina, which may smell fishy odor.
Yes.
Other discharge, they are not ordered. Bacterial vaginosis and fungal infections we are seeing in college going girls and women.
Girls. Yes. Right. So, can you tell us something about genital warts also?
Uh, See, we have about 30 and odd organisms which can be sexually transmitted. Hmm. I may call it as STI, and madam will call it that RTA, reproductive tract infection. She may not be much willing enough to say it is sexually transmitted. So these warts, what we see in the skin is common. What is different from the genital warts, even though they are caused by the same human papilloma virus. Antigenially, it is different. It is a different serotypes. We have about 30 to 40 types of this HPV, and each one may cause skin wart or sometimes oral, even cytomegalovirus. Sorry, things can be caused by these things. So, genital warts is sexually transmitted. We have to understand. Uh, when it is transmitted, the incubation, other we say incubation period from the entry of organism to development of signs and symptoms. It may be 3 months to 6 months. Nobody will be aware or attribute to sexual contact made 3 months or 6 months back. But the male can make out the wart very easily. Whenever they try to pass urine, then they can see. Many of them they retract the prepuce and see the warts either under surface of the prepuce and other things. Here in women, the vulval warts are late ceculae. Initially, the what virus particle enters into the vagina and posterior cervix. So we see what in the around the cervix, cervical canal, which cannot be appreciated by the women. They cannot see by themselves. And moreover, they can, if they want to see the genitalia, they have to use a mirror to see. That also they can see only the exterior, vulva and other things only. They cannot use a speculum like a lady doctor and see the cervix. So many times these are missed. So this, since what is asymptomatic, it may lead on to malignant cancer, cervix, sequelae or late complication of this human papilloma virus years after getting infected. This is a late punishment which women they have. So, human papilloma virus is the most common cause of cancer cervix, and we can make it the early stage of cancer by the routine examination, speculum and this one pap smear. You can make out the early changes in the cervix and do cauterization, or when it is advanced stage, we do hysterectomy. But this is a preventable, vaccine preventable disease. So for 30 disease, we have this one vaccine only for two, human papilloma virus and herpes and hepatitis B also. Three vaccines are there. So hepatitis B we routinely give many times. We from childhood itself we give hepatitis B vaccine. Whereas this vaccine for to prevent malignancy, we don't say it for human papilloma virus. Then ladies may not come forward to have the things. So we say it is for to prevent cervical cancer and
Yes.
give them this vaccine for human papilloma virus. It is better this vaccine is given in the before marriage itself, in the teenage itself, so that when they get married, we need not blame the husband or anyone else, but they can prevent themselves from getting the cancer.
That's really nice. Thank you, Dr. Balasubramanian, for joining us today. Could you show us the certificate, please?
Yeah.
That is just a small
See,
token of our thanks, sir. You have really guided us and the viewers very well today. I really appreciate it. Thank you so much. So that will
Thank
be
you.
all for today. Dr. KK Med Talks will return tomorrow at 7 p.m. with another edition of the show. Keep watching Dr. KK Med Talks. Namaskar.
Namaskar. Thank you, madam, for nice question you have posed, and I hope I have just
With all